morning, everyone. Welcome to the second module of our course on the quality evaluation of panoramic radiographs. My name is Brahma Kiswanjaya, and I'm pleased to guide you through this essential topic. Today, we will explore the principles and criteria for evaluating panoramic radiographs, ensuring we achieve high-quality images crucial for accurate diagnosis and patient care. Thank you for joining us, and let's get started. The title of the second module is the Quality Evaluation of Panoramic Radiographs. Let's begin by taking a look at today's agenda for Module 2. We will start with an introduction to panoramic radiography, followed by the criteria for quality evaluation, and we will conclude with a summary of a key points. To start, let's understand what panoramic radiography is. Panoramic radiography, also known as pantomography, is an imaging technique that produces a comprehensive curved image of the maxillary and mandibular dental arch along with their supporting structures. This image is created by rotating an X-ray source and an image receptor around the patient's head. Clinically, panoramic images are particularly valuable for diagnostic conditions that require extensive coverage of the jaws. Panoramic images are widely used in various clinical scenarios. They are essential for assessing trauma, locating third molars, detecting significant dental or bone diseases, identify large lesions, monitor tooth development and eruption, especially in mixed dentition, find impacted or unerupted teeth and root remnants in edentulous patients, evaluate temporomandibular joint pain, and identify developmental anomalies. Now let's move on the quality evaluation criteria. The first one is object covered. The areas covered include the left and right sides of both temporomandibular joints, the lower border of the mandible's inferior cortex, and the orbital base. The specific regions imaged may vary depending on the purpose of the examination and the particular area of interest being evaluated. Another important criteria is ensuring optimal contrast, detail, and sharpness. Contrast is there is difference between the radiopaque and radiolucent regions, with radiolucent images as black as a carbon paper. Details is the anatomical structure of object is clearly visible, and sharpness is outline or boundary of each anatomical structure is clearly visible. Clarity is crucial, especially in three specific regions: the anterior teeth and the left and right temporomandibular joints. Anterior teeth means the teeth in the front of the mouth, including incisors and canines, should be clearly visible without blurring or distortion. Left and right temporomandibular joints, located on both sides of the jaw, should be distinctly visible to assess joint structure and any potential abnormalities. For a panoramic radiograph to be considered of high quality, it should display the specific region with distinct and sharp details, allowing for accurate diagnosis and assessment. Symmetry is another key factor. The angle of the left and right mandible should be equal and clear. The shape, size, and position of the angles of the mandible on both the left and right sides should be comparable. There should be no significant distortion or discrepancies between the two sides. Ensuring symmetry of the angle of the mandible is crucial because it indicates that the patient's head was properly positioned during the radiograph, leading to an accurate and reliable image for diagnostic purposes. The nasal septum and the hard palate should also be clear. Nasal septum means the vertical partition that divides the nasal cavity should be visible without significant blurring or distortion. A clear nasal septum helps in assessing midline structures and ensures proper alignment of the patient's head during the imaging process. Heart failure means the bony structure that forms the roof of the mouth should be distinct and clearly visible. A clear heart failure helps in identifying any abnormalities or structural issues and also serves as a reference point for proper head positioning. Proportionality and equality of the anterior and posterior teeth are essential. Proportionality, the size of the anterior front teeth and posterior back teeth should appear natural and consistent with each other. The teeth should not appear abnormally elongated, shortened, or distorted. Equality means the teeth on the left side of the image should match the teeth on the right side in terms of size and shape. There should be no significant discrepancies between the two sides. Lastly, it's important to ensure there are no ghost images or artifacts. This can obscure important anatomical structure and lead to misinterpretation. Ghost images mean these are unwanted faint images that appear on the radiograph due to improper positioning or movement of the patient or due to the presence of metal objects, such as earring or glazing. Ghost images can obscure important anatomical structures and lead to misinterpretation. Artifacts, there are any extraneous marks or distortion on the radiograph that are not part of the patient's anatomy. Artifacts can be caused by various factors such as technical errors, equipment malfunction, or the presence of external objects. Common artifacts include streaks, lines, or spots that can interfere with the clarity of the image. To sum up, high-quality panoramic radiograph must meet several criteria, including object cover, contrast detail sharpness optimal, clarity of three regions, anterior teeth and left-right condyle, symmetry, the angle of the left and right mandible is equal and clear, the nasal septum and the hard palate are clear, the anterior and posterior teeth are proportional and equal, and lastly, there is no ghost image nor artifact that could interfere the interpretation. Thank you for your attention. I hope this session has been informative and helpful. If you have any question or need further clarification, please feel free to ask. Thank you for participating in second module on the quality evaluation of panoramic radiographs. I hope you found the information valuable and insightful. Ensuring the quality of panoramic radiographs is crucial for accurate diagnostic and patient care. Please feel free to reach out if you have any question or need further assistance. Wishing you all the best in your studies and professional practice. Goodbye, and see you in our next module.